Before the worlds began, you were always there. You are Alpha and Omega, beginning and the end. Awesome. Hello and welcome to the LivingWell broadcast. My name is Dr. Levonne Mitchell-Samon. I'm a primary care physician and I'm also board certified in internal medicine. My goal with the broadcast is to provide a way for you to send in questions that you may have regarding your medical care. It's not easy sometimes to get the answers that you need. Sometimes we're not even sure what's the right question to ask. So I'm hoping that this broadcast will help give you information that's helpful, that will help guide you along the journey towards better health. In 3 John verse 2, it says, "Dear friend, I hope that all is well with you, and that you are as healthy in body as you are strong in spirit." God wants us to be healthy in our bodies, our soul, and our spirit. And my goal is to guide you by giving some answers to questions that you may have so that you can make a better decision about your health. There's nothing like getting a good understanding of what's going on. So send in your questions and I'll do my best to answer them. So welcome and let's get into today's broadcast. Hello, LivingWell family. It's great to be with you again on this Saturday. I hope that you had a great week and that the Lord has been good to you. Remember that this is the day that the Lord has made, and we will rejoice and be glad in it. I'm so glad to be alive today. I'm so glad to be able to talk, to walk, to hear voices, to hear music, to hear laughter, and to be able to speak to you today from my heart. Today, our topic is going to be about the thyroid gland. There are many symptoms that can be a result of a malfunctioning thyroid, and it gets blamed for a lot of things. You know, people come into you and they say, "I'm gaining weight, I'm tired, it must be my thyroid." Well, sometimes that is true, but not all the time. There are many other reasons for being tired and overweight. But let's talk about the thyroid today. First of all, where is your thyroid gland? Well, it is in the front of your neck, right below your, or right above your collarbone, okay? And it can be functioning normally, or it can be overactive, or it can be underactive. There are symptoms that go with either one of those problems. We are going to talk about that. We're going to talk about the overactive thyroid, the underactive thyroid. We're also going to talk about problems with the actual structure of the thyroid gland itself, as to whether or not it's enlarged, which we may call a goiter, or it may have little masses or nodules, as we call it in medicine. And we are going to deal with that. So let's start off with the most common complaint and the most common disorder, which is an underactive thyroid. This is called hypothyroidism. For the most part, hypothyroidism, there is no known cause for it. But in past years, many years ago, when people lacked iodine in their diet, people would develop an underactive thyroid and would develop what's called a goiter, which is where the thyroid would become enlarged. But for decades now, they have been adding iodine to salt. And so that iodine deficiency is not seen hardly ever these days, because of course, we in America, we love our salt. But anyway, so there are the underactive thyroid can be caused by unknown reasons. It can be iodine deficiency, and it can also be due to an autoimmune disorder where the body is producing proteins or antibodies that are attacking the thyroid gland. And that's called Hashimoto's thyroid disease. Not very common, but it is common. Then you can have an overactive thyroid, but and most common cause for that is something called Graves' disease. But let's get back to the symptoms of an underactive thyroid or hypothyroidism. One of them could be fatigue, weight gain, changes in mood, including depression or anxiety, changes in the hair, where you can have thinning hair. You can have changes in the skin where it becomes dry, and your nails can become brittle and break easily. You can also have problems in the gastrointestinal tract, where you can have problems with constipation, where it's hard to get your bowels to move. Then uh, the that's the underactive thyroid or hypothyroidism. So then now on the other side, the flip side of that coin is where you have an overactive thyroid, which is called hyperthyroidism. There's an autoimmune disorder called Graves' disease, where again, antibodies are attacking the thyroid gland and causing it to overproduce hormone. And those symptoms can be noticed with also fatigue. So you can have fatigue with underactive thyroid and overactive thyroid. With an overactive thyroid, you tend to more commonly see weight loss, and it tends to be rapid. You can have mood changes such as anxiety. You can have palpitations where your heart is beating too fast. And in the hair, skin, and nails division, you can have the same problems that you do with an underactive thyroid. You can have thinning hair and problems with your nails being brittle and breaking easily. And then in the GI tract or the gastrointestinal tract, you can have diarrhea more commonly than you would constipation. So those are the two sides of the coin: hypothyroidism, which is underactive, and hyperthyroidism, which is overactive. Now, in regards to treatment, with the hyperactive thyroid, depending on how severe it is, you may need to actually get what's called an ablation of the thyroid gland, where they actually kill the gland because it's overproducing so much. Um, there are severe problems that can happen if it remains in that stage. And so they can do ablation. They can also give medication to try to calm the thyroid down. And in some scenarios, they may even do surgery to remove a part of the thyroid gland. Then with an underactive thyroid, which is hypothyroidism, most commonly the treatment is some form of thyroid replacement. So you've heard of thyroid hormones, different generic versus brand name, and there's Synthroid or levothyroxine or Levoxil. They're different names for the same thing. Uh, is there a difference between brand name and generic? For some patients, yes. For the majority of patients, it doesn't matter which one you use, but there are some individuals who do not respond to the generic thyroid hormone, or they cannot tolerate some side effects from it and may have to be placed on Synthroid. So that's the treatment for an underactive thyroid. How do you measure how the thyroid gland is doing? So that's usually by a blood test, and it's the TSH that is most commonly used as a screening test. And when that number is actually too high, it means that your thyroid is underactive. Doesn't make sense, but that's the way that it works. So if your TSH is too high, out of the normal range, above the normal range, that is considered an underactive thyroid. If you wanted to take a biology class and learn why that is, then you're free to do so, but I won't spend the time on the broadcast to explain that one. Now, when your thyroid is overactive, then your TSH is too low. So hyperactive, TSH is too low. underactive, the TSH is too high. So it's the opposite of what you would think. Now, there are various lab tests to determine more specifically how the thyroid gland is functioning. And there's a lot of controversy as to which test is the best and whether or not you need to test various um, variations on the thyroid hormone, such as T3, T4, reverse T3. I will not get into that today as well, but I will summarize by saying the TSH is a very good indicator of how your thyroid gland is doing. There are people that are dissatisfied with the traditional way that medicine is practiced when it comes to underactive thyroid medicine because they feel that their weight being too much or their fatigue is definitely based on the thyroid gland, even though the TSH levels are normal. Again, I cannot prove it or disprove it. I do know that there are other causes that need to be investigated. If you're feeling, tired all the time and feel like you can't lose weight and your thyroid levels are coming back normal, there are other things to look into. For example, I've had a patient that when I had them tested, they came in complaining with of the weight gain and the tiredness, and they used to be very active, and somehow within the last 6 months they just couldn't get it together, and it turns out that they had sleep apnea. So or there can be other things, congestive heart failure, diabetes, some underlying problem that has not been diagnosed. So I wouldn't just focus and hammer down on it being your thyroid if your TSH is normal. Ask your doctor to look for other causes. And then, of course, sometimes the mood affects our motivation, and we overeat and we don't exercise, and that leads to fatigue and weight gain. So it may not be a thyroid problem, it may be a mood disorder. Um, so there are other things to look for instead of just focusing on the thyroid gland. Now let's get to talk about structural problems with the thyroid. So I mentioned earlier something called a goiter, which is really an enlarged thyroid. There are some patients that you can actually see it without really having to feel the gland. You see it, a big lump in their neck, and that's a goiter. Sometimes you can have a goiter, but your thyroid function is still normal. Having a goiter or an enlarged thyroid does not necessarily mean that you need medication or that your thyroid is not functioning correctly. It's just that the size is enlarged. Now, more commonly with a goiter or an enlarged thyroid, the thyroid tends to be underactive. So patients with enlarged thyroids with a normal TSH should at least get a TSH checked yearly to make sure that the gland is still functioning properly. This also tends to run in certain families. So there are certain families that it's very common to find members of the family with goiters or underactive thyroid. Then you can have a mass on the thyroid or tiny nodules on the thyroid. Sometimes those are diagnosed by the doctor feeling the gland. And then for some people, it can be very obvious where even a non-medical person can see that one side of the gland is larger than the other. And when you have nodules or masses in the thyroid gland, if they're over a certain size, then a biopsy needs to be performed to make sure that this is not an abnormality, that's a malignancy. It's not very common to have a thyroid cancer, but it can happen. And so thyroid nodules above a certain size should not be ignored. They should be biopsied to make sure that it's not a cancer. You can also have nodules in your thyroid gland and still have a normally functioning thyroid. And that was one of the questions that I received in our email is, can you have thyroid nodules and having thyroid nodules Does it mean that the thyroid is not functioning properly? Is it overactive or underactive? Not necessarily so. So that's an abnormality with the structure of the gland, but not necessarily an abnormality with the function of the gland. So thyroid nodules, as I said before, can be malignant, but most of the time they are benign, that is non-cancerous. And if they're below a certain size, then they're monitored with a thyroid ultrasound, probably on a yearly basis, depending on what the first ultrasound showed. If the thyroid gland remains stable over, a certain period of time, then they may not need to continue to repeat that test. As far as medications for thyroid abnormalities, we had mentioned the Synthroid, which is the brand name, and we also have the generic of the thyroid hormone replacement. An endocrinologist is a doctor who specializes in treatment of thyroid disorders. Do you need an endocrinologist? It all depends on the problem. Most of the time, your primary care doctor can do the screening for a thyroid problem and also the management of a thyroid problem. If it becomes necessary to get a biopsy of a nodule, then that's when, for the most part, an endocrinologist is needed. Or in cases of Graves' disease, which is overactive thyroid, then you also need an endocrinologist to manage that. One of the signs of Graves' disease, as some of you may have seen, is where the eyes are bulging. And in severe cases, they're bulging so badly that the eyes become dry, and it's difficult for your eyelids to keep them moist because they're bulging out so much. Sometimes surgery is needed. There are also some medications that may help to decrease that bulging of the thyroid of the eyes from the Graves' disease. If you are taking thyroid medications such as Synthroid, levothyroxine, Levoxyl, or Armour Thyroid, it is important to take it in the morning on an empty stomach. So after you take your medication, you need to wait at least 30 to 60 minutes before taking any other medication, drinking coffee, or eating any food at all. So 30 minutes on an empty stomach, at least 30 minutes before consuming anything else, aids in the absorption of the medication to make it work well for you. Now, are there certain foods that you should eat if you have a thyroid disorder, or foods that you should avoid? I would say that there has not been a lot of research in this area that I'm aware of, but we do know that for some patients, a gluten-free diet may help, and of course, avoiding processed foods. If you have a vegan diet or certain diets that do not have any salt in it, you may become iodine deficient, and that can cause a problem with your thyroid. So you want to make sure that you have sufficient iodine in your diet. But for most people who are on a regular diet, you should have sufficient iodine in your diet. If you are over consuming certain vegetables that are juiced, they may actually produce a goiter. Don't get alarmed. This is not common, but I do want to mention that that is a possibility. If you're overeating cabbage, kale, Brussels sprouts, they have been known to sometimes cause a goiter in the thyroid. You can still eat it, but just don't overdo it. You should be able to eat a regular diet. Make sure, though, that you have enough vitamins in your diet. The iodine we mentioned, zinc, selenium, magnesium, iron. Don't go and purchase tons of these things and overdo it. Make sure you check with your doctor to see if you are deficient in any of these things, before you overdo it. But usually a multivitamin should be sufficient, but make sure that you have enough vitamin D because that's a common disorder, vitamin D deficiency. And yes, we do get vitamin D from the sun, and we are currently under a heat wave, so most of us are avoiding the sun. But the other source of vitamin D is in our diet. And so make sure that your vitamin D level is checked by your primary care doctor every now and then, at least once a year. So you want to make sure you have all the nutrients that you can, eat a nutritious diet. And also, if you do have an underactive thyroid with the weight gain and feeling cold all the time and the hair and skin problems, the medication alone may not reverse all of the symptoms. So there are things that you have to do to help yourself. And as we've always mentioned on this Living Well broadcast, you want to uh, exercise regularly and eat a nutritious diet. Remember, uh, if you have any specific thyroid problems or questions as to why you're feeling the way you're feeling, why I'm always, so tired, and why is it that I can't lose weight? You do want to get that thyroid level checked at least once a year if it's normal. And if it's abnormal and you're on medication, after you've been started on medication, they usually check that level in about 4 to 6 weeks to see if it's in the range where it should be. And every time the doses change, they repeat that test, usually in about 4 to 6 weeks. And in the meantime, do your part with your healthy lifestyle and living well. I want to remind you of our scripture. Our theme scripture is Psalm 139, verse 14. It says, I will praise you, for I am fearfully and wonderfully made. And I usually stop there, but I want to add the second part of it that says, marvelous are thy works. God has done a miraculous thing in creating our bodies, and we want to keep them well so that we can fulfill the purpose that God has for us while we are here. God bless you. Thank you for joining the Living Well broadcast today. Call your friends and neighbors. Tell them that Dr. Levonne Mitchell-Samon is on the air, and it's on Saturdays at noon. I hope that you have enjoyed the broadcast and that I've said something that has helped you. Please send in your questions to livingwellmd123@gmail.com. That's livingwellmd123@gmail.com. God bless you.
Before the worlds began, you were always there. You are Alpha and Omega, beginning and the end.
You have been listening to the Living Well broadcast with Dr. Levonne Mitchell-Samon. I hope that you heard something today that you found helpful and that will help you get better and live better. If you have questions about your health, your medications, or treatment plan, please send them to livingwellmd123@gmail.com. That's livingwellmd123@gmail.com. I will do my best to address them at a future broadcast. You can find me here on Awesome Radio on the first Saturday of each month at 12 noon. I look forward to speaking with you again at that time. And until then, live well and God